Dr. Darien joins us with a look at one of our viewers' questions. Here it is. Let's take a peek at it. What else could a breast mass be other than cancer?
I think this is such a good question because so many times, as we discussed briefly yesterday with Dr. Coleman regarding mammograms, you get that phone call and it can be terrifying. You have to come back, get another image, possibly get a biopsy. So there are some things that it can be that are not cancer, and I think it's important to know. First off, it can be fibrous masses. We often see those, for example, in young women. They can come and they go with your menstrual cycle and change as time goes on. The second thing, it can simply be a cyst. A cyst is just a collection of fluid that our body inappropriately develops. And then thirdly, it can also just be a calcium deposit. That's something that you might see in an older adult where it's been there for a long time and it hasn't changed. And then lastly, it can be an infection, especially for those who are breastfeeding. You can get abscess or infections that need to be treated, unfortunately, as a consequence of breastfeeding.
Are you a prescription for wellness?
This is an important topic that came up this week. Things that doctors would love for you to know. And so I sourced the other emergency doctors that I work with and I asked them what were the top 3 things. And it came out, we all kind of came out in a similar format. The first one was trust your gut.
I agree.
Especially if you have symptoms like chest pain or neurological symptoms like weakness or numbness, you really need to see a provider immediately. That's one of those things in the emergency room, regardless of your age or history. I'm fully attentive because I think it's always important to rule that out. Secondly, the power of movement. Physical inactivity is one of the major risk factors for cancer and chronic disease. We have to figure out how we can move at least 25 to 30 minutes each and every day. And then thirdly, understand and participate in your health care. Know your coverage, know what you have access to, and understand before you walk into that hospital, what is your plan of action? I think it's so important that we pay attention to what our plan is, very, very much the same way, and I said this before, that we pay attention to our bank accounts. You want to know that plan, the back and the front, and really read through it so that you can get through it and understand it.
You and I both know I use my coverage very well.
We all know.
I'll go to the ER for anything.
You're a perfect example. You know everything about your coverage. You actually help me understand things about my coverage.
See? All right, Doc, thank you very much. And folks, we would love to hear from you, so hit us up on Instagram with all of your medical questions at ABCGMA3.
Well, hey there, GMA fans. Robin Roberts here. Thanks for checking out our YouTube channel. Lots of great stuff here. So go on, click the subscribe button right over here to get more of awesome videos and content from GMA every day, anytime. We thank you for watching, and we'll see you in the morning on GMA.